Hi everyone, this is Ricky Spencer, and welcome to another of our series, our Voices series for the Sociology of Media for 2024. Today we are very privileged because we're going to speak to someone who's a leader in our community. And us, Anasina, as you notice, I'm dyslexic, so I do apologize again for mispronouncing her name. I'm sure correct me in a minute. Has spent many years working within the community sector within various communities of different cultures in a capacity of community engagement, community development, and project management. As a proud Polynesian woman of Samoan heritage, she is an passionate person, member of the Pacific Island community, where she has some strong footing. She has founded Engage Pasefika, a grassroots community organization to advance Pacific health equity across generations. After observing gaps in cultural responsiveness to health services, she is an advocate for intersectional health to advance diversity and cultural safety for underrepresented voices and shines a spotlight into person-centered care and to bring visibility to communities hardly reached. The lens at which she views health caring is underpinned by her community values of reciprocity, equity, intersectionality, and most importantly, family. Welcome.
Thank you, Ricky.
So
Thank you for the
please say your name so for everyone can pronounce it well, darling.
You were fine. My name is Anasina, and you're welcome to call me Sina, Ricky, if you like.
Beautiful. Well, thank you, Tina. And we're going into this. This is a really important sort of podcast because I think for a lot of people working in Australia, in working with diverse communities, sort of like having their head, what does a diverse community look like? What does it mean? What do I have to do? And I think before I roll into my list of questions, I want to throw to you, Sina, what's the most important thing that you can tell researchers out there they need to consider when they want to work with cultural, dare I say the word cultural diversity in their research spaces?
Well, first of all, I think that's a really significant question to begin our conversations with this afternoon. Often research itself talks about how researchers go out and seek out participants that are easy to access. And I think that whole idea speaks to the fact that diverse communities are somehow hard to reach. And I oppose that way of thinking because I feel that diverse communities that are isolated, that are invisible, are usually hardly reached. So I think I would like for researchers out there considering engaging diverse communities to be open, to be willing as well to have authentic voices in their research initiatives and projects, and be really, I guess, meaningful in their approach in terms of understanding the power differentials that exist between researchers and community or individuals, for example, and how do they approach and express power in their work, and thinking about, okay, if I'm a researcher here and I want to go in and engage a diverse individual or diverse communities, how do I ensure that power is shared? And how do I ensure that I enter that space with cultural humility and enter that space with knowing that you are both partners that share equity in the process? It's a really long-winded question.
No, but it was a
Long
really
answer.
good answer, and that leads perfectly into this question. Can you share with us your background and experience working in culturally responsive health services?
Yeah, sure. I think you already touched on that in my bio around experience in the community sector, around community engagement and applying community development principles when I'm working with culturally diverse communities. So for me, It's about, I've worked with obviously Pacific Island community. I've also worked with African diaspora and the Asian diaspora, predominantly the Burmese community. Understanding what are their cultural values, understanding that what their cultural beliefs are when you are working with them, in particular in the context of health, understanding what health means to them, because how they interpret health is going to be extremely different to, I guess, the Eurocentric / Western context of what health is. How do we approach health? So, for example, Pacific Island people, we come from collectivist ways of living and decision making. And that also extends to health. If someone in the family, whether that's your grandmother or your auntie, is sick, everybody rallies around to ensure that, you know, that person in your family is taken care of. And so part of the work that we do in advocacy is ensuring that our health systems, our health services are flexible to the different ways that communities understand health. So, for example, if we go visit somebody that's in the hospital, it's like the whole extended family. So we all go there and, you know, we say a prayer around their bed. And we also obviously abide by health rules that, you know, you can only have 2 people in there. But what they don't understand is that that's how we respond to health. So a lot of my advocacy is ensuring that we are considering communities' values and nuances when it comes to health.
And what inspired you to focus on cultural responsive care and services in the healthcare field?
I think COVID-19 really put a spotlight on the disproportionate impact that COVID had on our Pacific Island community. A lot of our people were presenting to hospital in really severe with severe symptoms. So they were like being admitted straight to intensive care. And so for me, it's sort of thinking about what's happening here. How can we better advocate for our people, to those in the health system, to ensure that they have access to health literacy and access to digital information as well around health. So I think cultural responsiveness, cultural safety in the landscape of healthcare really needs to be magnified and cannot be overlooked anymore, because it just has such dire consequences, as I saw.
And this question, I wanted to flip it a little bit differently. I want to say, from your experience, to people listening in the field who are privileged to be running programs in health spaces, how could they ensure that their services are culturally sensitive and inclusive of diverse, to include people of diverse backgrounds and beliefs?
I think, you know, it comes back to this idea of engaging, you know, and what does that engagement look like? Ensuring that it's not a tick box exercise, it's not performative. You are bringing the community in, or individuals in, to participate actively in decisions that involve their health outcomes. I think engagement is really important, and understanding that, you know, the world that we live in here in Australia, as the census data would reveal, 51% of the population speaks another language other than English. So therefore, I would say that our systems, it's time that we need to acknowledge and actively respond to the multiculturalism of our community, but also the rest of the diversity that exists within that.
And what challenges have you faced in implementing culturally responsive practices, and how have you set about to address them?
Yeah, that's a really good question. As you can see, Ricky, I'm a woman of color. I'm also a migrant. And, you know, for a lot of us as well, like I know people in my community that have disability, that are from the LGBTIQ plus, that are facing real precarity when it comes to living, whether that's vulnerability, whether that's housing insecurity, food, employment insecurity. And so, you know, the health system just recognizes us as a patient, for example, and doesn't quite understand those intersecting identities that a person, a patient, or a carer, or a consumer may have when they are seeking out those health supports. And I think, you know, the embedded values of the Western lens in terms of their understanding of health from a biomedical standpoint can be really limiting and challenging when you have somebody like myself or people from my community that have intersectionality,
Mm,
have varying social, cultural identities. Another thing is migration as well,
mm,
and people not having different residency status as well, and how that affects what they can access with health, and the lack of understanding on the other side of that from the health system to acknowledge all of these, I guess, vulnerabilities that once you when it's accumulated can really put that divide between individuals and community, and also increase the challenges as well. I think another big challenge is the lack of diversity in the workforce.
mm,
I believe, anyway, at least in my encounters and interactions, it's very much Anglo based. So sometimes that can be really hard when you are building networks, strengthening relationships with various stakeholders, but also in the advocacy work too, because like I said, it's very much founded and built on Anglo-Celtic ways of understanding health. And that in itself is not a reflection of our society today.
Sina, I've been fortunate enough to sort of getting to know you now over the past couple of months, and I know you're very passionate about when it comes to health spaces and ensuring that when we have systems like co-design and looking at changes that need to be made. And I know one of the issues that I've heard you raise before is the need for interpreters to be more given more kind of training in that space in health and working with different communities. Can you maybe explain to our audience why having health interpreters is so important when it comes to health equity?
Absolutely. I think having interpreters from various diverse communities really elevates cultural safety when it comes to the health landscape, because you know, if for in order for individuals, patients, carers to feel safe, they need to be able to access people that look like them, people that have those linguistic compatibilities. Super important. I mean, that absolutely goes towards advancing health equity, is to be able to access your language, because then you're also able, that also then perpetuates health literacy as well, because you could have a doctor or a clinician speaking to a patient, and often, you know, as much as they try to simplify, it's very much medical terms and jargon and so on, that a person whose English may not be proficient will just go over their head. And what happens there? They can't ask questions about their health, and then we're just isolating them even more as well. So I think it really strengthens cultural safety. But I think, you know, I have to make a point, Ricky, that when we talk about interpreters and the pathway to becoming interpreters, that in itself can be a barrier.
Mm,
You know, all the qualifications and credentials and the cost involved just to become a accredited interpreter in health and just across different disciplines is a real barrier for community members from diverse communities out there. They have to do a university course, all sorts. So I know that for Pacific Islanders,
Hmm.
they've had trouble accessing interpreters because there's so very few of us. And that's not to say that we don't want to be interpreters, but there's a real barrier in cost.
And now let's sort of spend this time really understanding a little bit about Pacifica so we can really, for people to really understand. Because when we're talking about, and I just spoke to you before about attending the International Indigenous Conference on Cancer, and there was a few comments made by some delegates that, where are our Pacifica sisters in these conversations? So let's explain, what does Pacifica mean? Where is Pacifica from, and why it's important when we're talking about Indigenous experiences globally. We need to really consider Pacifica in our conversations of health.
Well, firstly, I really appreciate and thank you for giving space to Pacific Island women to perhaps offer a bit more education around who we are as a people. So we identify ourselves under this umbrella of Pacific Island. But if you were to travel to the South Pacific, you would find that there are more than a dozen countries that come under the umbrella of Pacific Island. So my country is Samoa, and we're about a 5.5 hour flight from Melbourne. And we have our own language, we have our own values and our own etiquette and norms. And there are lots of similarities that sort of common ground for Pacific Islanders, but there are also a lot of distinctions. And often the misconception is that, oh, Pacific Islanders look the same, speak the same language, and there's homogeneity there, but we're not homogenous at all. We have our own language, and most of the countries in the Pacific have their own languages, are their own independent nations, and have obviously migrated to Australia for all the wonderful opportunities that Australia has provided for our community. Let me know if there's something else you'd like to know, Ricky.
And I guess on that sort of framing, could you tell us a little bit about the company that you've set up and that you've established, so that all researchers throughout Australia can understand and
Thank
reach?
Yeah, awesome. So I founded Engage Pasefika. So we are a very small grassroots community organization based out in the northern suburbs of Melbourne, more specifically in the Hume and Whittlesea local government area. And I guess our purpose, as you spoke to and as you kindly introduced, Ricky, is really about advancing health equity. And so we do that through our own values that are underpinned by family, faith, and community, and really ensuring that we are led by our community in terms of their living experiences when it comes to health, the gaps, the opportunities, the challenges, and how we can advocate for our people, not just at the micro level, but also at the macro level. So part of our work has involved, which I'm very proud, we had our first Pacific Island Health Equity Day last year as part of Women's Health Week. And once again, that event was really about raising the visibility of our Pacific women and all the health challenges that they experience, but also because they are the backbone of our community and our families, that if their health is affected, the whole community is affected. So a lot of our work, we are also underpinned by the social determinants of health. And so we also run a Pacific Island community playgroup. And this is really about, once again, building those connections, cultural connections, but also early childhood education to give our young Pacific learners the best start to life. And then we just run other community initiatives, tailoring to all our people. So we're not an organization that sort of tailors to, for example, just men's health or youth health or elders health. We actually take a holistic lens because that's who we are. That's how we identify with health, that it really is taking the holistic lens, that we look after our whole family, our whole community. So, yeah.
And I think we had a really wonderful conversation before we started recording about, you know, one of the areas of care and pain. And we talked about different sensitivities and how pain is a universal experience, but different cultures have a different understanding and process it. So maybe for those listening, can you give us a bit of an insight into like your reflections, why it's important when you may have someone going into your hospital space or in your medical space who is of Pacifica heritage? What do you need to consider when someone's presenting to you with perhaps a condition that may be causing them pain?
Yeah. I think so this goes back to the conversation that we had earlier about a lot of our Pacific Islanders presenting very late with their COVID symptoms, to the point where there was no choice but to admit them to intensive care. And this whole idea of, well, we don't want to inconvenience our families too much. So we will, I guess, sit with the pain until obviously it's, untenable, and you got to seek health interventions. So I think for a health service or a hospital to consider when they have a Pasifika patient or family coming through is that there is a lot of fear there, because you're entering a space that is, you're not going to see a lot of our people represented in the workforce or with, giving care. And we are working towards that. But I think, trying to be, I guess, approach with cultural humility and understanding that, I guess what they might be feeling may be completely different to what you might be seeing as well. And being, I guess, sensitive to that is going to be important. And also understanding that their family, like, that's just part of it. Like, we don't sort of like come in ones. We come in like in droves, so to speak. Even if we're just sitting out in the waiting room praying and things like that, we're very much faith driven as well as a people and as a community. So that's something else, to be, I guess, to consider when providing care, that we are very spiritual and faith driven.
And I think that's just such an important point for people listening who work in health spaces, is to really understand that within the Pacifica community, when one of the family members is unwell, that there is a lot of kinship and that will come alongside to help. So, and you have to realize it's not about threatening behavior. It's not about, it's about wanting to support. So it's about supporting the person in their health journey. So it's about thinking, okay, well, can we have enough space for families to come into this space, and maybe having a quiet room where people can say prayer or that to help someone with their health journey. So it's that sort of consideration with your work and because I know you're so busy and you're so involved in so many things now. What does the next 12 months look for you at this moment?
Um, so something that's really important to me when it comes to health equity is equity of data.
Mm.
And for Pacific Islanders, yeah, there's a bit of data on us out there, but that data is predominantly in youth justice.
Um,
I would like to change the narrative on that, and I would like to advocate for more representation in research and in health data for our people. If you want to look up Pacific Island prevalence and diseases and chronic conditions. I can't find anything here in Australian literature. I have to go to New Zealand, for example. They recently did a study, the Murdoch Research Institute for Children did a study here in Victoria on Pacific children because of the increase of rheumatic heart disease. For Pacific Island children here, that they were 80 times more likely to get rheumatic heart disease than First Nations children. So there's real, I guess, inequity in data. And the thing is, with the world that we live in, and the lens and the frameworks in which we view health is very much evidence-based, and that's where the investment goes. So if we're not represented in the data, there is no investment in our people, in our diverse communities. So the next 12 months is advocating for data equity in the health landscape. And if there are any health organizations out there that are thinking about Pasifika communities but don't know how to engage them, yeah, very happy to have what we call a talanoa, which is also known as a discussion in, I guess, Western terms.
Asina, it's been an absolute honor and privilege to have you on our Sociology of Media Voices series, and we'll definitely put your contact details under the post for those to make contact with you. And I'm sure you have a lot of interest in different health and education communities reaching out on how best to work with the Pacific communities across Australia. Thank you so much for spending some time with us today.
Oh, Paftai Lava. Thank you, Ricky. Thank you so much. Bye.